I will be talking weekly on Fridays, probably a little later next Friday, so I can get caffeinated enough to talk to you in a short 15 medical world of scapular pain in your shoulder blade, and then what we can do about it. So there's a couple reasons that you may be having some shoulder blade pain right now. One, you might be on the computer more than you ever have been before. And so you're probably stuck in one position and you're used to moving around. So, lack of movement is one reason where you might be having trouble. That area of your body, your upper back, also known as the back of your heart, kind of my hoodie area here, or your wing space between your shoulder blades, it is supposed to do a lot of movement for your back and for your spine in general. When you reach for something, it needs to move. When you lean over, it can move. And when you have less movement for prolonged periods of time, then it can become stiff. So not only do you have joints there that can become stiff just from lack of mobility, a change in a new routine. I think we all have that right now. I experienced this yesterday, so I'm happy to talk from a real life perspective today. Another reason is you might have a flatter upper back, and that sometimes also needs more mobility. You might also be sitting at the computer or for your job or be hovering over children like I am. You might have a bit more rounded back. And one thing that can happen with that sometimes as our technology draws us in or children draw us inward or something below, leaning over patients, for instance. When I used to work at the hospital, we tend to be very heartfelt and lean over and be close to people. But when we do that, our chin ends up coming forward so that we aren't looking at the floor, but rather the person in front of us or what we're doing. And you can see how that kind of just kinks your neck right up, right? Even if you try to sit up tall, you might still be leaning in. And in order for your head to stay level, you probably are doing this. So a couple quick tips. If you are on the computer or your device, try to hold it, try to get it up, at eye level. So that means your computer screen, you want ideally to be in the top, your eyes to be looking at the top 1/3 of your screen. For your phone, same thing. Try to hold it up rather than be doing this. And get it at the right distance for you as you age 40 and up. That's you. I'm in that group now. That your eyes aren't looking so far. So either do you have to squint and get closer, or can you bring it to the right distance where your eyes can be free and feel relaxed? So that's what I would suggest for the moment in terms of your neck. And why am I talking about your neck? Because there are a lot of muscles that attach right along here, the base of your head, the back of your head, the sides of your neck, that actually attach right into the shoulder blade area. And I'll show you better in a minute. But one other thing that can happen is if you end up in this position a lot, you can end up with a pinched nerve in your neck, and I don't want to. You can have some pain radiate, we call it, down or send pain down into any areas between your spine. So I'm just gonna take this off so you can see better, and also because we're gonna do a couple exercises, and I hope you'll join me. So right here between your wing space, you could get pain pretty much at every level where you have a vertebrae. And also you have your ribs coming in there. So if you're not using your breath as much, if you're not exercising as much, moving as much, you have not only your spinal joints connecting in there, but you also have your rib cage connects into your spine. And so you have more potential for irritation from your muscular groups around that area, and if your joints aren't moving as much. So let's do something about that, eh? I am going to just pull this up. Okay, so today I want to talk about 3 exercises you can do. And this is great because not only will it improve your mobility, it might just get rid of your pain. If it does, awesome. Please send us a message or comment and let us know. We'd love to know that helped you. It also will help you with your breathing because I'm going to use the breath as a yoga teacher to do our exercises. So we breathe in a certain way, and we breathe out as we move through the movements, and that helps us not only kind of connect our mind to our body and what's happening, but it also will help decrease the volume on the pain and the tension in your system. And I think we could all use a little bit of that right now. Your upper back also, when it's not moving, means that the rest of your spine has to move a bit more. And so that can create more irritation in your low back. So regardless of what's happening in you right now and any pain that you might be experiencing in your neck or your mid back or your low back, I invite you to just try these. Of course, only please listen to your body. If it doesn't feel right for you, don't do it. Just ask the question to yourself and you'll know exactly what to do. Okay, so we're going to do 3 exercises, like I said today. The first one is just a little pumping of the heart. Okay, so go ahead, and you don't even have to sit up tall if it doesn't feel good right now. If you've had irritation in your back and you're like, I just need to sit in a couch slump position, do that. It's totally cool. So take your arms out to the sides. Just make some space for yourself, the length of your arms. If you have some ambient noise behind you with the video, I apologize. One of my pets has come to join us today. So take your arms out to the side. Woo, big wingspan, sorry. And then on your inhale, stay here. Now you can let your arms find a happy home between your hips and your shoulders, wherever you feel like you can be without it creating more tension in your neck or your spine. We're gonna stay here for the inhale, breathe in through your nose if you can. And then exhale, round your back and allow the backs of your hands to come together, your neck to drop down. So we're gonna try this 3 times. As you breathe in, take your arms open. As you breathe out, flip your hands, keep the backs of your wrists together. Good. Inhale, open. Send your heart up to the sky. Squeeze the back of your heart. Exhale, round the back. I'm going to guide you through one more while I send this little creature out. And inhale, take your arms out to the side. Exhale, round your back. Bring the backs of your wrists together. Perfect. So we're pumping the heart. We're moving the thoracic spine or the mid-back in this forward and backwards motion. Feel free to squeeze your front side and squeeze or your shoulder blades together as much as you like. Next, twists are really good because we are lacking that in our daily movement. So we're going to take a twist here. First, breathe in, look up, reach your arms overhead. Exhale, twist with one arm forward, one arm back. Inhale, reach up. Exhale, twist the other way. Inhale, reach up. Maybe look up. Exhale, twist the first direction. And then one more time. Inhale, look up. Maybe you take a little back bend and squeeze your shoulder blades. Maybe your arms are nice and wide. And then exhale, release the other side. So bring your arms back up to center. Bring your hands into your heart space. Feel your thumbs on your chest and just close your eyes for a moment. Good. Let your chin nod down towards your spine, towards your heart, and then allow your head to come back up and find a happy place for your head. You can take one ear to one side and then the other side and just come back to center. Good. So those are two easy exercises you can do throughout your workday, in between activities at home. This one will take a little bit more effort because we're going to get on the floor. So if you have pets or children at home, see if you can find a way for 2 to 5 minutes to lock them out of what you're doing. I'm going to turn so you can see me. We are going to do the next exercise is called the Sphinx. And we're going to do that here on the floor. I'm just going to make sure that you can see me. Okay. So if you're a yogi, you probably done. Let's try that. Come down onto one hip, walk your way down onto the floor, and then shift your hips onto the floor. Notice that I have to adjust just a little for you here. Going to get your elbows right underneath your shoulder. If you've done this before actively in a practice, we generally push down through the forearms and kind of raise yourself up. But today, we're going to take a yin approach and a myofascial release approach where you just allow your belly to start sinking down. Inhale, release the buttocks, the heels, maybe even the head. And every exhale, just let your belly drop down on the floor. You can let the shoulders come up towards your ears. Inhale, feel your spine lengthen, feel your rib cage get full. Breathe into your back. And exhale, let the belly come down. As you do this, you might find yourself sinking down towards the floor a bit more, and you might need to adjust your body so that so just walk the elbows forward slightly. You can see that releases the tension naturally in the neck. And even if I sink down, it still is making space around the neck and into the chest to allow for greater mobility around the shoulders. Scoop. So let's take a couple more breaths here. We'll breathe into the armpits. Settling in with each breath. Letting the head go if that feels best for you. As you do this, you can continue to hold, and I'll just keep talking to you. The first time I did this, I was pretty sure that my back was going to break in half. So if you feel that way, just remind yourself that you are lying on your stomach, you're safe on the floor, and put some props or like pillows underneath you to make you feel more comfortable, then go ahead and do that. But nothing is breaking you besides gravity and your breath. So just breathe into those spaces. Let's take one more breath. In waves. So you might feel an intensity, a rise in sensation, whether it's pressure, a sharpness, or something else. But if you're holding in one spot and not moving, then it should come back down. If it doesn't, stop what you're doing. And when I mean shoot us a message, tuneetree@gmail.com, or jump on our Facebook page and send us a message or comment that way. I would love to help you. So just wrapping up today, we did our 3 exercises. Just need to adjust this camera so you can see me a little bit more. We did our pumping. And then we did our twist. If your shoulders aren't having it, you just take a twist here. And if you like that and that feels good, you can just stay in one direction for a couple of breaths. Like that. And then lastly, we did the Sphinx, where you lie on your stomach, you let your toes come in of your body so that your backside of your body can relax down and create more movement with just the help of your breath as well as gravity. Thank you so much for watching today. And I look forward to seeing you again next Friday, a little bit later in the morning. And please don't hesitate to reach out if these don't work for you and you need further help, or you're wondering if you're doing them correctly. Just schedule a session with me by commenting, shooting us a message or an email, and we'll set up a date. I'm available virtually to help you with your own specific needs, and would love to do that. So remember to do all the exercises at your convenience, listening to your own rhythm of your own breath. And be sure to check out my back pain video from last week. And we'll see you again soon.